Welcome to the Thunderdome. I'm gonna pick up where I left off, and I was just waking up. So I remember waking up with a few nurses around me, texting things out, checking my blood pressure. One nurse asked if I wanted my CPAP mask on because I have sleep apnea, and I was pretty tired, but I'm like, I'm awake, I'm not going back to sleep. I just spent enough time sleeping. So I felt okay. Not a lot of pain yet. Felt a little funny, a little stiff. Just didn't really feel like myself. Not a big deal, you know. Basically what I'd expect from waking up from surgery. So, about 20 minutes is my guess I spent in the recovery room waking up, feeling better, them checking me all the time. And off I went back to my post-op room. My wonderful wife was there to see me when I came in. She was very relieved, and I was very happy to see her, because any surgery, the big D word, of course, is a worry, but it's a risk you gotta take sometimes. The surgeon came in to see me shortly after I came to the room and told me that the surgery was a success. Yay. Good news. But it took him longer than expected, and he actually had to try 5 times to get the gastric band, the Realize band, adjusted properly and exactly where he wanted it. But he did get it in, and at that point I'm thinking, 5 tries. Wonder what time it is. I look and I'm like, wow, I've been gone for 2 or 3 hours. When I was supposed to be gone for about 45 minutes to an hour. I bet you my wife was freaking out. I was under for a lot longer than normal. But hey, I got my surgery. I was happy. So then the nurse came in and brought me my first drink. Yes, I can try this new tool out. It was a little cup of, I think it was fruit juice. It was fruit punch, and it was awesome tasting. Wow. But I'll get to that in a second. I took a little sip. Okay, feels normal. Took another little sip. Feels good. Nurse went, okay, just keep taking your sips. Looks like you did good. We're gonna start up your discharge papers. Sweet. In and out the same day, just like I wanted to be. I'll be home in my own bed at night. Excellent. They filled my prescription for the liquid Oxycontin for my pain. I was starting to get a little pain there. They still had my IV in, but now I was in discharge status, so they couldn't give me any more drugs for my pain. But hey, I had Oxycontin coming and whatnot, so it's okay. Then, all of a sudden, I didn't feel too well. And I vomited. Okay, I don't know how to use my tool yet. I drank too fast, I did something wrong. Everyone vomits their first time, right? Let's try this again. Keep drinking slowly, doing everything the way I'm supposed to. Vomit. They gave me anti-nausea. Vomit. Vomit. Dry heaving. That went on for about 10 to 15 minutes before they put me NPO. No orals allowed. But since I was still discharge status, I couldn't get any pain meds in my IV. So at this point I was in a lot of pain. It took them about a half an hour to get my status changed to where I could get pain meds. Thank goodness. And they switched me to an overnight patient, and in the morning I would get a barium swallow test to see what was going on. But for now, since it was so late at night, everything had happened, I was spending the night. Even though my clothes had been like 5 feet away, I'd been ready to get dressed, I was ready to go home, but I'm spending the night. Okay, one night, I could do this. So, all night long, I wandered the halls. I attempted to sleep, and I got about 2 hours maybe total of 5 or 6 hours in bed. Because I would have to put on my mask, get adjusted, try to get comfortable in this hard, uncomfortable hospital bed. And I'm full of drugs. Trying to sleep, then wake up, vomit up, spit, foam, saliva, slime every half an hour, then try to put my mask on, get adjusted, try to sleep again, over and over and over and over and over. And to top all this off, you guys might not know this yet, but I have severe panic disorder. All my panic disorder meds are oral meds. I'm not allowed orals because nothing was going down. So no panic meds. The only thing I got was Ativan that came in through my IV, which I was not used to and was not my normal regimen. So I was starting to freak the frick out. This was my first time that I went, why did I do this to myself? I felt like I'm vomiting, this isn't working, I'm having the worst night of my life. I mean, it's just, it was not a good experience at all. The whole night, I just kept telling myself, it's for the best, it's for the best, you made the right decision, it's best for you, it's best for your family. And I just focused on the next morning, I'm going to get my barium swallow, they're going to figure out what's wrong, and they're going to fix it, I'm going to be out of here. No big deal. Well, anyways, that was part 1. Next time I'll talk about the barium swallow and the results, and whether or not I had to spend more time in the hospital. You'll just have to wait and keep tuning in. I'll see you next time.